Good morning, the camp directors and other principal officers, the state director. Good morning, my fellow crew members. My name is Dr. Muslim Al-Akatabum. I'm from Bauchi State, currently serving at the Wamuk Orientation Campaign. Our topic for today is the cervical cancer. So this cervical cancer is the cancer that affects some part of the female reproductive organ, specifically the cervix. And this cervix is the organ that is just behind the vagina and before the uterus. So in other words, it's actually in between them. So it somehow connects them, okay? In the sense that whenever there is sexual contact and if there is ejaculation or sperm releasing, it has to pass through this particular cervix for it to enter the uterus before we can be able to have pregnancy and etc. And also, if baby is coming out, it passes through that same cervix, okay? So we're talking about the cancer of that particular region. So it's really common in the northern part of the country, making it even the most commonest, and the second most commonest in the southern part of the country, making it an extremely important cancer. The main causes of this cervical cancer is human papilloma viral infection as well as herpes simplex viral infection, both of which are sexually transmitted disease. As we know, we have gonorrhea, syphilis, chlamydia, genital warts, HIV, hepatitis. So herpes simplex virus and human papilloma viral infections are also considered as sexually transmitted disease. So what do we see in a patient or in a person with cervical cancer? These are the key important signs and symptoms that you have to remember. Number one is abnormal vaginal discharge. The reason why I use abnormal is that vaginal discharge is actually normal in women, so we don't consider it as a symptom that is abnormal unless it is persistent or if it is presenting with an abnormal smelling or unpleasant smell, especially if it is accompanied by bleeding. That bleeding is really important because many females may present with abnormal vaginal discharge. Doesn't mean they have cervical cancer. They may have one condition or the other, like pelvic inflammatory disease. So this vaginal bleeding as well, we have to remember that female normally they do menstruation. So the fact that you are menstruating and at the same time you are having vaginal discharge also doesn't mean you have cervical cancer, unless if there is underweight or you are losing your weight. Okay? Almost all the cancers in the world they present with one of the most commonest symptoms, which is weight loss. So weight loss, especially if it is unexplained, you are eating very well, you don't have any problem, and you're not on any medication, but you are still losing weight. So this is an important factor that you have to consider. Fourth one is lower abdominal pain. If you are seeing this type of lower abdominal pain, if it is persistent, you have taken a lot of these antibiotics, but still it's persistent, vaginal discharge, painful sex, painful menstruation, discomfort, there is not any form of satisfaction once it's all cancer. You have to be careful and you have to actually think you may have this cervical cancer. So what are the risk factors? As I've mentioned earlier, the first is sexually transmitted disease. So how do we normally get sexually transmitted disease? We have sexual contact, especially with multiple partners, regardless of your gender. If you are a female sleeping with multiple men, even if they are two, they are considered as multiple.